días. Mi nombre es Mauricio
Good
Massa,
morning.
soy
I'm
el asesor
Mauricio
regional de
Massa. I'm the
prevención y control de
Regional
cáncer de la
Advisor,
Organización
Prevention and
Panamericana de
Control
la
of
Salud.
Cancer at the Pan American
Para
Health
mí es de
Organization.
mucho grato
It
ser
is
el
a true
moderador en
pleasure
un día
to
tan
be a
especial como
moderator
es el Día
today on
Mundial
this special
contra el
day,
Cáncer. En
the
este
World
día
Cancer
nosotros
Day.
honramos a los
Today,
que
we
hemos
honor
perdido por cáncer.
those that we have
Nos
lost due to
recordamos de la
cancer. We
importancia de
recall
apoyar a
the
aquellas
importance of
personas que están
supporting the
viviendo con esta
people who are
enfermedad
living with
y al
this
mismo tiempo
disease.
damos una
At the
mirada
same time,
al
we take
pasado,
a
lo que hemos
look back
aprendido
to see what
y
we
una
have
mirada hacia el
learned
futuro,
and a
cómo
look
vamos a
forward
seguir
to see
avanzando
how
para
we will
asegurar que
continue
podamos brindar
moving
apoyo a
forward
todas
to
las
provide
personas
support
que lo
to all
necesitan.
the people who need it.
Antes de iniciar, me
Before
gustaría
beginning,
comentarles que
I
este
would like
webinar
to
se puede
inform you
escuchar
that this
en español
webinar
y
has
en inglés.
interpretation services,
Pueden
can
ver
be
en la
heard
parte
in either
inferior
English or
de su
Spanish.
Zoom y
In the lower
decidir cuál es
portion
el
of your
idioma que
Zoom, you
desean
can select the
utilizar.
language you wish to
También hay
listen
un chat
to.
en el
There
cual
is
se puede
also a chat
interactuar. Me
function.
gustaría si
It's
pueden escribir
possible
su
for you
nombre
to
y país de
interact. Please
donde
put down there
residen para
your
saber
name
desde
and
dónde
your
se
country
incorporan a la
so that
reunión del día de
we
hoy.
know who
Para
has joined
iniciar el
us for
día de
this
hoy, el
today.
webinar,
To begin
tendremos
today's
unas palabras
webinar, we will
alusivas para el Día
hear
Mundial contra el
some
Cáncer de parte
words
de nuestro
from
director, el
our
doctor Jarbas
director,
Barbosa.
Dr. Jarbas Barbosa, about the World Cancer Day.
La Organización Panamericana de la
The Pan
Salud,
American
OPS,
Health
se complace
Organization,
em
PAHO,
informar
is
que a
pleased
Comunidade
to
Mundial de
join the
Lucha contra el
global
Câncer para
community to
comemorar el
combat
Dia Mundial
cancer, to
contra el Câncer.
commemorate the
El
World
tema de
Cancer
esse ano
Day.
é
The
Unidos
topic this
por lo
year is
Único,
linked
que
for the
hace
single
hincapié na
thing. It
adoção de enfoque
focuses
centrado
on
nas pessoas
adopting
para o
an
tratamento do
approach
câncer.
focusing on
La
people when
OPS está
treating cancer.
comprometida com a prevenção e el
PAHO
controle
is
del câncer.
committed
Uma
to
enfermedade
control
que
and
cada ano
prevention of
afeta
cancer,
mais
a
de 4
disease that
milhões
every
de
year
pessoas
affects
na
over
região
4
del
million
América.
people in the region of the
Para reduzir a
Americas.
carga del
To
câncer,
reduce
uma
cancer
das
burden,
principais
one of
prioridades
the
é
chief
melhorar o acesso
priorities
ao
is to improve
tratamento
access
oportuno
to
e de qualidade
timely
contra
and
essa
quality
enfermidade.
cancer treatment.
Entre os obstáculos mais
Among
importantes se
the most
encontram os
notable
custos de
barriers,
los
we have the
medicamentos
cost of
essenciais contra
essential
el
cancer
cáncer
medicine,
e los
as
procesos
well as
ineficientes de
the
compra,
inefficient processes
distribuição e
for
suministro.
procurement, distribution,
Para
and
abordá-los,
supply.
é necessário
To
adotar um
address
enfoque
these, it's
sistêmico
necessary
que
to have
incluya
a
atualizar
system
os
approach,
protocolos de
including
tratamento,
updating treatment
consolidar as
protocols,
compras e abordar a
consolidating
qualidade e
procurement,
el
and
alto
addressing
custo de los
quality and high
medicamentos
costs
essenciales
of
contra el cáncer.
essential cancer
En esse
medicines.
sentido, o
In
Fundo
this
Estratégico da
regard,
OPS
PAHO's
oferece uma
strategic
plataforma
fund
excepcional
offers an
para
outstanding
abordar alguns
platform to
destes
address
obstáculos
some of
e
these
melhorar o
barriers and
acesso
improve
aos
access
medicamentos
to essential
essenciais contra
cancer
o câncer.
medicines.
Insto a todos os
I
Estados
urge
miembros da
all PAHO
OPS
member
a que
states
utilizem
to
melhor
better
esse recurso,
utilize this
que oferece
resource,
opções
which
essenciais
offers
para o
essential
diagnóstico,
cancer
tratamento e a
medicines
prevenção dessa
as
enfermidade.
well as
Entre essas opções se
HPV
encontram,
tests.
por exemplo,
For
as pruebas
instance,
de detecção del
we
VIH
also
para el
have
tamizaje del cáncer
cancer
cérvico-uterino,
screening
los
and cervical
dispositivos para el
precancer
tratamento de las
treatment
lesiones
devices,
cervicouterinas precancerosas y las vacunas
and
contra el VPH.
key tools
Todas
against
ellas
HPV.
herramientas
All of these
claves
are key
necesarias para la
tools
eliminación
needed
del cáncer
for
cervicouterino,
elimination of
una
cervical
prioridad
cancer and to
para la
make it a
OPS.
priority for
En el
PAHO.
caso del cáncer
In the
infantil,
case of
para la OPS es
childhood
un
cancer,
orgullo ser
PAHO
parte
is
de la
proud
plataforma
to be a
mundial para el
partner
acceso a los
of the global
medicamentos contra el
platform for
cáncer
access to
infantil.
childhood
También
cancer
colaboramos
medicines. We also
estrechamente
work
con el St. Jude
closely
Children's Research
with St. Jude
Hospital y
Children's
el
Research
UNICEF
Hospital
para
and
mejorar la
UNICEF to
disponibilidad,
improve
la
the
asequibilidad y
availability,
la entrega
affordability,
oportuna
and
de
timely
medicamentos
delivery of
esenciales
essential
contra el
cancer
cáncer pediátrico.
medications.
Es fundamental que
It
sigamos
is
trabajando
crucial
en
that we
línea de
continue
consulta
working
y que
together
hagamos un enérgico
with a
llamado a que
strong
los
call to
gobiernos den
governments
prioridad
to
al acceso a los
prioritize
medicamentos,
access
equipos
to
y insumos
essential
esenciales
cancer
para el
care,
tratamiento del
medicines,
cáncer en la
equipment,
región.
and essential
Al
supplies
conmemorar
in the
hoy el Día
region.
Mundial contra
As
el
we
Cáncer,
mark World Cancer
reafirmemos
Day
nuestro
today, let
compromiso
us
con esta causa.
reaffirm our commitment to
Juntos
this cause.
podemos crear un
Together,
futuro
we
en
can
el que
create a
nadie se
future
quede sin
when
el
no one
tratamiento
is
contra
left
el cáncer
without the
que
cancer
necesita
treatment they
para
need
poder
to
sobrevivir
survive
y
and
vivir
thrive.
plenamente.
Deseamos expresar nuestra gratitud a nuestro
We want
director
to thank our
por sus
director
palabras el día de hoy, el
for his
mensaje que ha
words
compartido en
today
las
and the
redes
message
sociales.
he shared
El
in
director ha
social
puesto el
media.
cáncer como una de
The
las
director
prioridades
has
de la
prioritize cancer for the organization, this being a public health problem included in the non-communicable diseases that need to be treated in a timely way. Let us now hear from Dr. Ansel Helmis. He is the Director of Communicable Diseases and Mental Health at PAHO.
Good day. And I wish to extend
Buenos
a warm
días y
welcome
deseo dar
to
una
honorable
calurosa bienvenida a los honorables representantes de los ministerios de salud, miembros del Comité del Plan Nacional de Cáncer, puntos focales de las oficinas de país de la OPS, fundaciones y hospitales. Señoras y señores, yo soy el doctor Ansel Helmes, soy el director del Departamento de Enfermedades No
It is with
Transmisibles.
great pleasure that I bring you greetings from the Pan American Health Organization and the Cancer Technical Team. As we commemorate World Cancer Day today, February the 4th, we gather with a shared commitment to improve cancer care, a disease that affects millions of individuals across our region. PAHO works with countries to address a wide range of challenges related to cancer prevention and control. And I'd like to highlight a critical issue that directly impacts survival and continues to be a significant barrier to care. This is access to essential cancer medications. Access to timely and quality cancer treatment is limited in Latin America and the Caribbean. The Global Platform for Access to Childhood Cancer Medicines, a collaborative initiative led by the World Health Organization, the Pan American Health Organization, UNICEF, and St. Jude Children's Research Hospital, was established to promote access to life-saving medications for children with cancer globally. This program aims to improve the availability, affordability, and timely delivery of these cancer medications, addressing gaps in access to treatment in low and middle-income countries. Ecuador is the first country to implement this platform in the region of the Americas and has made significant progress, guaranteeing at least 36 pediatric cancer medicines and 62 formulations, strengthening capacities for early diagnosis and treatment of childhood cancer, and promoting knowledge transfer, technical resources, and evidence-based tools to implement sustainable programs. This initiative demonstrates effective technical cooperation between the Ecuadorian government, the PAHO Strategic Fund, and international partners. We call on member states to strengthen their efforts in effective procurement of pediatric oncology supplies, ensuring that patients facing cancer receive timely, high-quality treatment. PAHO will continue supporting countries in the implementation of Cure-All, the WHO initiative to reduce mortality due to childhood cancer, providing technical support for the design of national plans and the development of educational and technical resources. PAHO is also implementing the strategy to accelerate the elimination of cervical cancer, and significant efforts are being made to prioritize and improve access to technologies for cancer prevention and control. HPV vaccines, tests, colposcopes, and thermoablation devices are available through the regional revolving funds. Governments play a pivotal role in ensuring sustainable and effective access to these resources. Comprehensive policies are the foundation of quality cancer care. As such, there must be prioritization of vaccination against preventable cancers, such as the human papillomavirus or HPV vaccine, necessary to reduce the burden of cervical cancer, and eminently preventable, yet still among the most prevalent cancers in the region. Many member states have already made significant strides in implementing HPV vaccination as a public health policy and adopting the single-dose scheme, which increases uptake and coverage. These efforts require coordinated actions, robust political commitment, and sustained investments to ensure no one is left behind. As we mark World Cancer Day today, let us reaffirm our commitment to improving access to and availability of comprehensive and high-quality cancer treatment services as PAHO continues its support of countries in the implementation of the WHO Global Initiative to reduce cancer morbidity and mortality through the provision of technical support in the design of national plans and the development of educational and technical resources. We look forward to your insightful presentations and discussions and thank each of you for your contributions to this critical cause. Thank you so much.
Muchas gracias. Deseamos agradecer al Dr. Hennis por
We'd like
dar
to
esa
thank Dr.
introducción
Hennis
y dar el
for
panorama
these
actual de las
opening
iniciativas que
words
nosotros
and to
tenemos
present the
en
panorama
combate al
about the
cáncer, la
initiatives that we have
iniciativa
to combat cancer,
para
the
el cáncer
initiative
infantil,
for
tenemos la iniciativa para
childhood
celebrar la
cancer,
eliminación
the
del
initiative to
cervicuterino y la iniciativa
eliminate cervical cancer, the
global de
the
cáncer de mama
World
y la
Breast
importancia de
Cancer
tener,
Initiative.
para
And the
lograr esto,
importance to
tener
achieve
excelentes
this is that
colaboradores
we have
como es
excellent
St. Jude
collaborators,
Research
such
Hospital
as the St.
y
Jude Research
cómo
Hospital.
es importante mejorar
And
el
it is
acceso a los
very important to
medicamentos,
improve
insumos y
access
equipos
to
para la
medicine
prevención y control de
supplies and
cáncer.
equipment to
Para
prevent and
iniciar
control
nuestras
cancer.
ponencias,
To
tengo
kick
el agrado de
off,
poder
it is my
presentarles a
pleasure
ustedes
to
a Santiago
introduce to
Cornejo.
you
Él
Santiago
es el gerente
Cornejo.
ejecutivo de
He
los
is
fondos
executive
rotatorios
manager of
regionales
the regional
de la
revolving
UPS
funds
y
of
él nos
PAHO,
hablará
who will be
sobre
talking
el
to us
acceso efectivo
about
a vacunas,
effective
medicamentos
access
e
to
insumos
vaccines,
oncológicos
medicines,
para la región.
and
Con
cancer
ustedes
supplies
dejo
in the
a
region.
Santiago.
I offer the floor to
Muchas
Santiago.
gracias, Mauricio, y es
Thank you very
un
much,
placer estar
Mauricio.
aquí y
It is
poder
a pleasure to
presentar
be with you
el
today
rol
and
de
to
los fondos
present the
rotatorios
role of
regionales
the
del
regional
UPS
revolving funds of PAHO
para colaborar y
in
ayudar
order to
a
collaborate
un
and
acceso
help
más oportuno
have a
a los
timely access
medicamentos,
to
vacunas
these
y
medicines,
diferentes insumos
vaccines, and different
necesarios
supplies
para
that are
tratar el cáncer.
required
Quisiera
in order to
tanto el
treat
director,
cancer.
el doctor
The
Barbosa, como
director,
ambos
Dr.
integrantes
Barbosa,
mencionaron el rol
and
de los fondos
Dr. Hennis
rotatorios
have
y cómo estamos
mentioned the
trabajando
role
en
of the
conjunto
revolving funds and
con
how we're
todos los
working
Estados
together
miembros
with all
para hacer
member
un
states
acceso más
in
equitativo,
order to
que
have
es
a
fundamental
more equitable
para
access,
tratar el
which is
cáncer.
crucial in
La
order to
próxima, por
treat
favor.
cancer.
Entonces voy a ir un poquito en detalle sobre
Let me
los
provide some details
fondos
about these funds,
rotatorios.
the revolving
Los fondos
funds.
rotatorios regionales
The regional revolving
incluyen el fondo
funds
rotatorio para
include
el acceso a
the
vacunas y el fondo
revolving fund for
estratégico para
access to
insumos
vaccines and the strategic fund for
estratégicos de salud
strategic
pública.
public health
Los objetivos
supplies.
de
The
estos fondos
objectives
es
of these
asegurar el
funds
acceso
is to ensure
a estos
access
insumos
to
a
the
todos los
supplies
Estados
for
miembros de la
all
región,
member states in
más
the
allá de sus
region, going
oportunidades
beyond
o sus
the timeliness
características
or
económicas o
whatever their
demográficas.
economic or demographic
También
characteristics
aseguramos,
may
perdón,
be.
la anterior, aseguramos que sean
We also
asequibles, que no sean
ensure that they
precios
are
que se puedan
affordable, the
sostener
prices need to be
durante el tiempo.
sustainable over
Es muy
time.
importante la
It is
disponibilidad,
very
asegurarnos que la
important to ensure
disponibilidad de estos productos
availability.
no sea
These
tan
products
solo por
need to be
un tiempo,
available
por un
not
año, sino
only
que se
for one
puedan
year, but they
asegurar
needed
por
to
varios años
be
y eso es lo que
available over
analizamos
time.
en las
And this
diferentes
is what we
licitaciones.
focus on
Y por
when we
último, y lo
have
más
our
importante,
procurement efforts. And
garantizar
most
que todos
importantly,
estos
we need to
productos que se
ensure
dan
that
a
all
través de los
these
fondos
products
rotatorios del
obtained
UPS
through
han sido
the PAHO
evaluados
revolving funds
en
have
los
been
requisitos en base a los
evaluated
requisitos
based
internacionales,
on
a los estándares de
international
calidad
requirements and
para asegurar
quality
que todos los
standards to
productos
ensure that
que
all the
entran en los
products
países
that
cumplen con esos
countries
requisitos.
obtain
La
meet
próxima.
these
¿Cómo hacemos esto?
requirements.
Esto se hace a
Now,
través
how do we do
de más
this?
de 60
Well,
años de
over 60
experiencia
years of
que tenemos
experience
trabajando con los Estados
working with
miembros,
member
tanto
states
con los dos fondos, en
with
conjunto
both
con los dos fondos,
funds.
y ahí consolidamos
And
la
here
demanda
we
de más de
consolidate the
42
demand of
países y
over
territorios,
42
dependiendo de los
countries and
productos,
territories,
pero
depending
a
on the
través de esa
products.
consolidación de
And
la
through this
demanda
consolidation
conseguimos
of
mejores
demand, we can obtain
oportunidades para
better
los países.
opportunities for
Trabajamos no
countries.
solamente con
We
ministerios de
work
salud,
not only
sino
with
con más de
ministries of
27
health, but
agencias
also with
de
over
salud en los
27
países
health
públicas
agencies in
y hemos
countries,
estimado
public
que en los
institutions.
últimos 2
And we
años más
believe
de
that in the last
180
2
millones de
years, over
personas han sido
180
impactadas
million people have felt the
con teniendo
impact
acceso a productos
because they have
financiados
had
a través de los
access
fondos
to
rotatorios.
products that
Para dar
procured
unos
through the
ejemplos
revolving funds. To give
de esta
just some
consolidación de la
examples of
demanda,
this
por ejemplo, en
consolidation of
vacunas
demand.
hemos
When it
comprado más
comes
de
to vaccines, we
460
have
millones de
purchased over
dosis y eso nos
460
ha
million
ayudado a
doses,
través
which
de
have
esta
helped us
consolidación
through this
a hacer ahorros de
consolidation
más del
to save
50%
over
de los
50%
precios
over the price compared to bilateral purchases that can occur throughout the world. Likewise, when it comes to treatment and diagnosis, we have procured over 23 million treatments for countries, achieving price reductions. We have also reduced prices of antiretrovirals when we're working not only with member states, but also with other global partners, such as the global funds, or in the case of cancer, working with St. Jude's, as well as UNICEF and WHO. When we talk about cancer, what can we offer? Well, we provide vaccines. We know today that technology gives us an opportunity to prevent some of the cancers via vaccines. We also have diagnostic kits, different ones, and they are crucial in order for early detection of cancer. And now it's also possible to access drugs for cancer treatment. We have 33 of these already through this initiative for childhood cancer. But through this initiative, and of these 33 drugs, there are over 74 presentations available. And we have obtained very favorable conditions in price and time for them, and always ensuring quality. This has been done through a global procurement, working together, as we have already mentioned, with other players. It's also important, and I reiterate this, that it's not only a matter of price, because through the funds, we also evaluate the quality of products to make sure that they all meet with international requirements and standards. We also work with all the technical teams at PAHO, so that it's not only a procurement, but it's technical cooperation, providing counseling or advice to member states with the different protocols, the different devices, or the different products that are needed. As I pointed out, we have over 30 products, 74 presentations. I can't go into the details of each and every one, but I have three examples on screen now to show what we've achieved through this procurement. For the methotrexato, you can see that the price we have achieved, there is a saving of up to 88% compared to the prices in countries. And this is the prices that the countries shared with us. And this has helped us make the analysis. Vincristine, here again, 87% in price difference through this access. Obviously, each country, they have different prices, but in this example, the prices that we have achieved have been the lowest. Likewise, with imatinib, there's also almost 100% price differential if you procure or purchase them through the revolving fund. So we have these cancer medicines, and for some interventions, and especially the HPV initiative, they can be an integral approach through the revolving funds. Through the vaccine fund, you can prevent them. We have vaccines, three different types of vaccines that you can access, or the countries can access in order to prevent HPV cancer. We also have different diagnostic tests that are available depending on the technologies or methods used in each country. And lastly, as you heard, treatment. Here again, you can obtain devices for treating these diseases. These are existing agreements, but we're also working through the funds to ensure that these technologies can be developed in our region and can be also produced in our region, because that will provide us with a more timely access under better conditions. So that is another priority for the funds. It's not only access, but to provide incentives for regional production
tecnologías como
of
las
some of
vacunas
these
y el diagnóstico.
technologies, such as
Gracias.
vaccines and
Y mi
diagnostic
colega
tests.
luego va a hablar
My
más
colleague
detalles
will
sobre
be
VPH.
providing more
Aquí, pero
details
esto no
about
termina aquí.
HPV,
En los
but
fondos,
this doesn't
los Estados
end here.
miembros
Member
han
states
identificado
have
los medicamentos y los
identified
precios como el
the
gran desafío
high-cost
que
medicines as
tienen
being a
para
major
asegurar
challenge
un
in
acceso
order to
equitativo.
ensure
Entonces
equitable
estamos trabajando
access.
con
So
ellos
we are
en una
working
iniciativa
with
de
them
medicamentos de
through
alto
an
precio para
initiative
ver
of
cómo podemos
high-cost
trabajar en
medicines to
conjunto
see how we
para
can join
mejorar esas
efforts
condiciones y
to
que su
improve the
avance sea
conditions
mejor.
in
En acceso
order to
hemos
improve
identificado
access. We have
6
identified
intervenciones para dar
6
prioridad,
interventions that we are
los
going
cuales
to
no significa que sean las
prioritize.
únicas, pero
This
sí
doesn't
cuáles
mean
hemos
that they're only
comenzado.
ones, but they're the
Ya hemos
ones that we are
logrado
beginning with.
consolidar demanda
We have
y ya hemos comenzado la
consolidated
licitación en
demand
una
and
primera fase.
started
Todas
bidding in
ellas es para
phase
combatir el
one,
cáncer,
two
tanto el
for
cáncer de próstata
cancer,
como el cáncer de mama.
combating.
Y aquí
This is
estamos mostrando las
prostate and
diferentes
breast cancers.
tratamientos
These
medicamentosos
are the different
para esos cánceres.
medicines
Para el
for
cáncer de
these
mama es una
cancers.
primera fase y luego va
For
a haber una
breast
segunda
cancer,
fase
there'll be
donde
a
vamos a
phase
incluir
one, then
otros
in
más
phase two
y
will
también
include
esperamos
others.
también
And we also
para tratar
hope in the
melanoma
case
sarcómico.
of
Como dije, este es
metastatic
el
melanoma.
procedimiento,
As
no
I
es el
said,
final.
this is
Estamos
a
aquí empezando con
beginning.
estos
This is not the end.
medicamentos.
We are
El
beginning with
objetivo es
these
demostrar
drugs.
un
The objective
impacto y
is to
continuar
show
aumentando
impact and
y
then
con otros medicamentos
scale up
más.
to other
La siguiente.
additional medicines.
Para concluir, entonces
To
quisiera
conclude,
resumir y
I'd
decir
like
que
to
a corto
summarize
plazo
and say that in the short
todos los
term,
Estados miembros pueden
all member
acceder
states are
a
able to
vacunas,
access
test de
vaccines,
diagnóstico y
diagnostic
también a más de
tests,
30
and
productos
over
para cáncer
30
con
products for
precios
cancer
competitivos, como ya
at
lo hemos
competitive
mostrado.
pricing levels, as
Pero no
we
solo
have
eso, si
shown. But
logramos
it's
que
not
más
only that,
países
if more
se unan a
countries
esta
join
y logramos una mayor
this
consolidación de la
effort and
demanda,
we can further
somos
consolidate
muy
demand,
optimistas que
we
podemos
feel very
mejorar
optimistic
las
that we can
condiciones
further
que ya
improve
tenemos
the
ahora, que son
conditions that we're
beneficiosas y se
already
pueden mejorar.
enjoying. So these
A
good
mediano
conditions
plazo
can be
estamos
enhanced. In
trabajando
the
y
medium
tenemos una
term,
gran
we are
oportunidad
working and we have a
para
great opportunity
también tener un impacto
to
similar en
also
otros
have a
medicamentos
similar
en esos de alto
impact with
precio que
other
he mostrado.
drugs,
Y aquí
such as
también
the
necesitamos
high-priced
que
ones
todos
that
los
I just
países
showed.
se
Here
sumen
again, we
a
need all
esta
countries
consolidación
to
de la
join
demanda
this effort to
para poder conseguir
consolidate
mejores
demand in
condiciones.
order to
El
negotiate
mensaje
better
es que juntos
conditions.
somos más
The
fuertes. Lo
message
hemos
is that
demostrado
together we're
otros,
stronger. We've
en otras
demonstrated
intervenciones y
this
con
in
otras
other
vacunas,
interventions,
con otros
such as
medicamentos.
with
Queremos
vaccines and with
ahora
other
tener el
drugs. Now
mismo
we want to
impacto
have
que
the
hemos
same
logrado
impact
con
that we
los
have
medicamentos
enjoyed.
necesarios para tratar el cáncer. Muchas
Muchísimas gracias, Santiago. Creo que
Thank you
lo
very
que
much,
dices es
Santiago.
válido si es
As
que
you
se puede
said,
hacer.
joined or
Eh,
we can do it.
Comentarles
All
que pues
together,
la
we can do
sala,
it.
hemos
So
llenado
let
la
me
sala
tell
de
you
Zoom.
that
Ya hay
we
personas
have
que
now filled
desafortunadamente
the
no han logrado
Zoom group.
entrar,
Some
pero
people, unfortunately, were not able
esperamos poder
to join
compartir la
because we have
grabación,
limited
mencionar
capacity,
que
but we will
tenemos a
share a
representantes
recording.
de
But let
Honduras,
me tell you,
Uruguay,
we have
Colombia,
representative
México,
of Honduras,
Argentina, Perú,
Mexico, Argentina,
Panamá,
Peru,
Ecuador,
Uruguay, Panama, Ecuador,
Chile, República
Chile,
Dominicana, El
Dominican
Salvador,
Republic, El
Costa
Salvador,
Rica,
Costa Rica,
Bolivia,
Bolivia,
Surinam,
Surinam,
Guatemala, Haití,
Guatemala,
Jamaica,
Haiti, Jamaica,
Guyana,
Guyana,
Antigua y Barbuda,
Antigua and
British
Barbuda,
Virgin
British
Islands,
Virgin Islands,
Estados Unidos, de
United
Cuba.
States,
Estamos
Cuba.
muy felices que
So we're
estén acá y
extremely
tal vez
happy to have
recalcar
you
unos
all
cuantos
here with us
puntos.
today.
Como
And
mencionó
let me
Santiago,
underscore, as
esto no solo
Santiago also
es un
said,
tema de
this
compras, sino que
isn't only a
también
matter
va
of
acompañado de la
procurement, but
cooperación
furthermore,
técnica que hacemos
technical
nosotros como
cooperation
organización,
underpins it. This is
ver
provided
ese
by the
significativo
organization
ahorro de
in order
88
to
hasta
have
100% de los
savings
costos que
of
ciertos
88 to
países están
100% in
cubriendo
the costs for
y
some
poder
countries.
hacer eso accesible para
And
los
we want to
países
make
es
this
el
accessible to
mensaje
all
más
countries. That
importante.
is the most
También
important
veo que hay
message.
colegas de
I see we
Nicaragua
have
que nos están
colleagues from
escribiendo.
Nicaragua also. They're putting their
Nuevamente lo que
texts in the
queremos
chat.
es
What we want to
asegurarnos que todos
do
los
is
países
ensure
entiendan que
that
este
all
mecanismo
countries
existe,
understand
entiendan
that
los
this
beneficios
mechanism is
y cómo
available
puede
to them. They need to understand the
significativamente
benefits, how
reducir
they can
los
potentially and
costos. Y
significantly
para hablar un
reduce their
poco más
costs. And to talk a
ya
little
de
bit
productos
more
específicos,
about
en este caso
specific products,
relacionado a
And in this case, they are related to one of the most important initiatives we have, which is to accelerate elimination of cervical cancer. It is my pleasure to introduce Nora Quiron. She's a sub-regional advisor of the Regional Revolving Fund. She will be talking about access to HPV tests through the strategic fund and other supplies, material, and equipment to prevent and control cervical cancer. Nora, you have the floor.
Buenas tardes. Muchas gracias
Good
por invitarnos
morning, and
también
thank you very much for
a
this
este
invitation
webinar que
to a
creemos
webinar,
muy importante
which we
para
find is
compartir con
truly
ustedes
important
sobre
to
todo lo que
share
estamos
with you,
haciendo, tal
especially
como
what
lo ha
we are doing.
expresado nuestro
And
gerente
as
ejecutivo
stated by
en los
Executive
fondos
Manager,
regionales y
the
específicamente en el
regional
fondo estratégico
funds,
para
specifically the
continuar
strategic
con
fund, in
el
order
proceso de
to
apoyar a los
continue with the
países
process of
al
supporting
acceso y
countries in their
disponibilidad
access and
de
availability
medicamentos,
of
de insumos de diagnósticos
medicine,
y de equipos de
diagnostic
diagnóstico,
tests,
ahora
and
que estamos
supplies,
trabajando en
now that
conjunto
we
con
are
los países y de
working
manera
together
interprogramática.
with countries
Como
in an
mencionó
interprogrammatic fashion.
Santiago,
As Santiago
los
pointed
fondos
out,
están trabajando de
the
manera
funds
coordinada
work in
para
a
lograr
coordinated
el
manner
acceso, la
to
disponibilidad
ensure
y sobre
access,
todo para que estos
availability,
productos
and
sean
especially for the
asequibles a
products to
todos
be
los países
affordable for
y que
all
cumplamos
countries,
con todos los
and
estándares de
that we
calidad.
comply with all quality
El
standards.
portafolio del fondo estratégico,
The
como lo
strategic fund
mencionaba, tiene
portfolio, as he
medicamentos,
mentioned,
pero
include
también
medicines, but
tiene los kits de
also
diagnóstico y
the
equipos de
diagnostic
laboratorio
kits
y
and
Santiago nos va a
laboratory
referir
equipment. And that's what I want
específicamente
to
sobre
refer
lo que
to,
venimos
as
trabajando
specifically what we've been
para
working
lograr
on
tener un
in
acceso
order to
equitativo a
have
las
equitable
pruebas de
access
BPH y
to
además a las
HPV tests,
plataformas y equipos
as
y
well
de
as
otros equipos
platforms and
médicos
equipment
para el
and other
tratamiento
medical
de las
equipment
lesiones
to treat
precancerosas. Y aquí
precancerous
también
lesions.
ya hemos incluido
We have
en el
already
catálogo y en el
included
portfolio
in
del fondo
our
estratégico
catalog
los
and the
equipos de
portfolio of the
termoablación,
strategic fund,
colposcopios
the
y también
thermoablation
generadores
equipment,
electroquirúrgicos que han
colposcopics,
sido
and
solicitados por los Estados
electrosurgical
miembros. Todo esto lo venimos
generators
haciendo
as
en el
requested by member
marco
states. All of
de
this we're
la
doing in the
iniciativa de
framework
mejor
of the
atención para las
initiative
enfermedades no
of
transmisibles.
better care
Como
for
ustedes
non-communicable
saben, venimos
diseases. As you
trabajando
know,
fuertemente
we have
en
been
cáncer cervical,
working
cáncer
in
de mama
cervical
y
cancer, breast
especialmente en
cancer,
cáncer
and
hemos
in
venido en
particular when
cáncer
it
de cara,
comes to
hemos venido
cancer, cervical
trabajando
cancer,
en
we
hacer
have
los
been
paquetes para las pruebas de
developing
BPH
packages
y los
for
equipos de
HPV
pretratamiento
packages, the
y las
pre-treatment
vacunas.
equipment, and
Un tema
vaccines.
importante acá ha sido el trabajo que hacemos con los
What's
países
important here is the work
previamente
carried
en
out with
revisión de
countries to
protocolos,
review
algoritmos,
protocols,
listas nacionales de
algorithms,
medicamentos y de
national
diagnósticos para que
medicine and
estos
diagnostic
estén
lists so
alineados
that
con
these
las guías
are
de la OMS, pero
aligned
también
with
que sean un
the WHO,
facilitante
but that
para
way they can
lograr
become
tener estos
facilitators
productos.
in order
Los
to
estudios
obtain
de
the
disponibilidad y
product.
acceso han sido importantes
Studies
para
of
conocer qué precios
availability and
tienen los
access is
países a nivel
important to
local,
see the
qué
prices
limitaciones en el
that
acceso
countries
tienen,
face
de
locally,
manera que
what
podamos
limitations
apoyar
they have to
también
access.
a
That way
eliminar
we
esas
can
barreras.
help
Y allí
bring down
el
those
trabajo
barriers.
de mejorar la gestión de la cadena de
And the
suministro
work
es
of improving the
importantísimo
supply
para
chain
que
is very
aseguremos que
important here to
tengamos
ensure
unas estimaciones
that we
adecuadas
have the
y
right
que
estimates
logremos en toda la cadena
and
logística,
throughout the
desde la
logistic
adquisición,
chains from
el
procurement
almacenamiento y la
to
distribución,
storage and
sea
distribution,
cumpliendo
we
con las
can
buenas
comply
prácticas.
with
Por esto
good
mismo estamos
practices.
trabajando fuertemente con la
We are
consolidación
therefore
de la demanda,
working in
tratando de identificar
consolidating
la
demand,
demanda
trying to
potencial de cada
identify
uno de
potential demand
los
for
países,
each of the
tener un buen
elements
proceso
in
de
countries, have
adquisición
a good
y
procurement
cumplir con
process,
las buenas
and
prácticas
comply
de
with
almacenamiento.
good storage
En esa
practices.
línea, estamos ofreciendo desde el Fondo Estratégico
Through the
todos
strategic
los
fund, we
kits
are
de
offering
diagnóstico
all the
para el virus del
diagnostic
papiloma humano, todos
kits
precalificados por
for
la OMS, así
HPV,
que
all of
tenemos
them
una gama
pre-qualified by
amplia
WHO.
de
We have
los
a
kits
broad
para la
range
detección de
of
HPV.
kits for
Hemos logrado
HPV
precios
detection. We
mucho
have
más
achieved
accesibles que
prices
los
that are
que los
far more
países tienen.
accessible
Hemos
to those
visto y
countries
hecho unos
obtained
estudios
directly.
y vemos que
Some
se han logrado
studies
precios
have
asequibles y
shown
estamos en
that
este
such
momento
prices have
tratando
been
de
achieved. And
lograr
right now,
bajar
we are trying to further bring down the price. Not only are we procuring diagnostic kits, many countries are also asking for the platforms and the equipment for these technologies. So we are also working with pre-qualified providers to purchase diagnostic equipment. We have already purchased expert in 10 colors, 4 modules and 16 modules. And in addition, we have overcome the challenge so that not only we have kits, but also the accessories needed to gather and preserve samples. So we are working very closely with providers in order to meet country demand.
And now it is necessary to make demand visible for all of these platforms and devices to support more quickly the countries. We, together with a technical unit, to comply with the guides and WHO guidelines, we have included colposcopes. We have developed the technical specifications with the technical units, and we have also been able to have colposcope prices because we are offering to the countries both traditional colposcopes and mobile colposcopes and also the video colposcopes. So we have an important list in the supply of colposcopes. And we have also worked with strategic global partners to attain preferential prices. We also have thermocoagulators, and we have also generated electrosurgical generators, and we are already working in the procurement of thermocoagulators with countries in the region. So we are available to provide more information about the technical specifications and procurement for these devices and other services provided when procuring a device or equipment, and also not only the device itself, but also accessories and maintenance for a later review. Here, it is important for countries to avail themselves of these opportunities. For us, it's very important to determine the price of demand for medicines and other devices, because this facilitates our work with providers, especially for the production and delivery. And another important area is to obtain preferential access prices for given economies of scale, etc., and make sure that all countries make joint procurements on behalf of better technical processes and to better strengthen the current health systems. And there's the facility to use a credit line to move forward the procurement process when funds are not available on time, and when we need to initiate the procurement processes as soon as possible to have on a timely basis these products. And this is not a procurement process itself. We have a whole team working and providing technical cooperation to initiate the process of the supply of medicines for diagnosis, but also the management of providers, the monitoring of supplies and shipments to verify that when a product arrives, it's well received, but we also need to monitor the necessary stocks in the countries. And we believe that together we are stronger, and working together we will
apoyar a los
be able
países
to
en
support
lucha
the
contra
countries
el
in their
cáncer.
fight against cancer. Thank you very much.
Muchas gracias, Nora. Nuevamente, juntos
Thank you
somos
very
más
much,
fuertes.
Nora, again.
Totalmente de acuerdo.
Together
Tal vez
we are
recalcar los
stronger. I
mensajes
totally agree.
claves
And I would like
para tu
to stress
presentación sobre
key
el trabajo en
messages also
conjunto
for your
técnico va de la mano
presentation
con
about the
esto.
joint technical
Hemos
work that goes
trabajado en
hand in hand
desarrollo
with
de
this. We have worked
algoritmos,
in
en
developing
tener la disponibilidad de
algorithms
acceso para
and to
acomodarse a la
have
previsión de la
access
demanda. Es
availability
importante escuchar de
to
los países
preview
cuáles son sus
demand. It's
necesidades en
important
la actualidad
to listen
con
to
la
countries
disposición
about their
de
needs.
tener la termoablación ya
For example,
negociado
now
con
to have
bajo costo,
thermoablation, we have
dispositivos
already in that
biomóviles,
area
video
negotiated low
call
costs with
móviles.
mobile,
En realidad
mobile
es
and
otra
video
gran herramienta
colposcopes, which
y si hay
are
más
also a great tool.
necesidades,
And if there
por
are
ejemplo,
more
si
needs,
creen que se
for
necesita
example, if you
más para el tema
believe
de
that more is
colposcopía
needed
con
when it comes to
toma de biopsias
colposcopy
o
or
tratamiento
to
cervical, lo
take
que crea necesario,
biopsies
siempre es
or
importante
cervical
escuchar de
treatment,
ustedes. ¿Qué
it's
otros
always
insumos creen que
important
fuera
to
importante
listen
poder
you to
incluir
you
dentro del abanico de
when if
opciones
you
o
indicate what
organizaciones que están
other
identificando
topics
a través de las
you
necesidades
think
de
it's
los
important to
países? Nuevamente,
include.
muchas gracias, Nora. Y
Thank you very
ahora
much again, Nora.
vamos a
Now
seguir
we will continue
ya con las presentaciones de países que
with
tienen
country
pasar
presentations
de un
from
poco de la
countries
parte didáctica,
that have
digamos, de lo que
moved from
nosotros estamos
the
haciendo, a un
teaching
poco de la
part about
práctica de
what
lo
we
que
are
se está
doing,
realizando en
moving
países
to the
miembros
practice
de
of
la
what is
organización.
being
A
implemented in
continuación,
member
la
countries of
doctora
the
Carolina
organization.
Excelent,
Now,
médica
Dr.
infectóloga del área de
Carolina
técnica
Selend
científica de la Dirección de Control de
of
Enfermedades
the
Inmunoprevenibles del
scientific
Ministerio de Salud
area
de
of
Argentina, nos va a hablar un
immunopreventable
poco sobre la
diseases from
prevención
Argentina. She
de
will talk
enfermedades
about
oncológicas por medio de la
the
vacunación.
prevention of oncological diseases through vaccines.
¿Pueden ver mi
Good
presentación?
morning.
Sí
Good
podemos.
afternoon. Can you see my
Perfecto. Bueno,
presentation?
muchísimas gracias por la
Thank
invitación.
you
Lo que
very
voy
much
a
for the
pasar a
invitation.
explicarles es cómo es la estrategia de vacunación en Argentina,
I will
la
address
vacuna contra
the
VIH y contra HPV.
vaccination strategy in Argentina against HPV and
Bueno, vamos a hablar un poco de VPH y
cervical
cáncer,
cancer.
de cómo es
We'll
nuestra
talk about
estrategia en Argentina,
HPV and
cómo se
cancer, what
implementó la
is the
única dosis
prevalence in
durante el último
Argentina,
año,
how
la
was the
incorporación de la
single
vacuna llamada
doses
PETEC y sobre la
implemented
vacuna
in the
contra
last year,
HPV.
then polyvalent and
Con
monovalent
respecto
vaccines.
a la carga de enfermedad del
As
cáncer
to
cervicuterino,
the
todos los que están
disease
en este
burden
webinar
of
probablemente lo
cervical
conocen, es
cancer,
el cuarto tumor con mayor incidencia y
it's the
mortalidad entre mujeres,
fourth
más de 600.000
deadly
casos son
tumor
diagnosticados
for
al año
women.
y más de 341
More than
mujeres mueren cada año a causa
604,000
del cáncer
cases
cervicuterino.
diagnosed
Lo que
each
podemos
year,
ver
and more
en
than
ambos mapas es cómo el rango
341,000
de
women
incidencia
each
como
year
la mortalidad
die
es muy desigual
for
y
cervical
también
cancer.
coincide
We
en
see that
lugares
the
con
distribution in
menos
both maps is
recursos
very
hay
unequal.
mayor incidencia y
The
mortalidad de
lower
mujeres.
resources countries have more
Nuestro
mortality
país
and
no queda
incidence.
lejos de lo que pasa en el
Argentina
resto del mundo.
is
Nuestro
not
país diagnosticamos
different from the
4.500
rest of the
casos por
world.
año
We
y tenemos más
identify
de 2.000 fallecimientos por año a causa de
4,500
esta
cases
enfermedad
by
y
year and
la distribución
2,100
también es
deaths
muy
per year
heterogénea.
given this
La
cancer. And the
media de
distribution is very
mortalidad cada 100.000
heterogeneous.
personas es de 7,7, pero tenemos algunas
The
provincias que en
median is
particular Formosa, que es una de
7.7,
Chaco,
but we have
esas son las
very
provincias con menos
poor
recursos,
provinces
con una tasa de
who have
16,4 y
fewer
15,
resources, which
más cercanas
have
quizás a
a
países
rate of
dentro del África, por
15.1,
ejemplo, o
16.4,
algunas
similar to
provincias, por
African
ejemplo, Capital Federal, con una tasa de
rates, and
4,6, que es
also
casi el doble
other
que las provincias
more
desarrolladas.
richer provinces with
En
lower
base a
rates.
esta inequidad, como todos ya saben,
Based
la
of
Organización
this,
Mundial de la
based
Salud
in
definió los
this,
objetivos 2030 para un
WHO
mundo sin cáncer cervical
determined
y a
the
propósito de
2030
esta meta,
goals
este
without
país alcanzó el
of a
porcentaje de
vision
cáncer
of a
cervical.
world
Para
without
esto
cervical
necesitamos que el
cancer, and
90%
we
de la
need
población de las mujeres
for
de
this
menos de
we
15
need
años reciban
90%
al menos
of the
una dosis de
population
vacuna
of
contra VPH,
girls
que el 70% estén
be
tamizadas y que el
vaccinated with
90% de las
HPV
diagnosticadas
vaccine
reciban el tratamiento
before
adecuado.
turning 15 years old.
Nuestro país tiene
Argentina
su forma integral también para la prevención del cáncer cervicuterino.
has a
Contamos
comprehensive
bueno, con la vacuna, el
prevention
Programa
of
Nacional de
cervical
Personas menores
cancer.
de 11
We have
años.
a
También
vaccine,
se realiza el tamizaje
and
del
we also
cervical
do
en mayores de
screening
25 años
through
y
PAPs
en mayores
in
de 30
women
años
of
a
more
través de
than
test de
25
detección.
years
Y a
and
su vez, el
other
Laboratorio Nacional de
techniques for
Referencia
those
Dominical
of
de la
more than
VIH
30
realiza
years.
estudios
And then we study the impact of vaccine and prevalence of HPV types of higher risk in the population. And we work with the National Cancer Institute and the Malbrán Institute, which are two very important institutions in Argentina. As to the HPV vaccine, this vaccine is available in 194 countries. In Argentina, given all the modifications that took place, the decision making is as follows. First of all, the DSA starts analyzing evidence, and the experts analyze the available devices, and they deliver their result to CONAIN that issues recommendations based on which the health ministry makes guidelines. We have a bivalent HPV vaccine since 2011. Then in 2014, we moved to the quadrivalent vaccine also for the prevention of HPV also in boys. And we included boys and girls of 11 to 26 years of age with HIV and transplanted. In 2015, we moved to 2 doses, and in 2017, we included males of 11 years of age or more, and in 2024 we moved to a single dose, and we simplified the scheme and we extended the scheme to the population with a non-valent vaccine. The idea, both in Argentina and all over the world, it's fundamental that this strategy for this vaccine be mixed, especially school vaccination. As to coverage, and what we see in Argentina is similar to the rest of the world. You can see the vaccination between 2011 to 2019, green first dose, blue second dose, and yellow third dose. We always have very good coverage of vaccination. Every year, more than 80% of women. But what we saw also were many differences between the application of the first and the second dose. When we analyze the coverages, we see here the first doses of HPV for women and for men in the first column, 85% in women. In 2020, during the pandemic, the coverage went down to 71%. In 2021, 75%, and 2022, we reached up to 82.6% coverage of HPV-1 vaccine for women. And to the right, we see a coverage among males, which is much lower than what we saw previously. In 2022, we attained 47% among males. In 2023, we implemented HPV coverage with first dose. In Argentina, this change was based on the fact that not all places have the adequate access. Some jurisdictions are much better than others, and this has supply problems. So we have a lot of work. We are very proud that our country has been able to implement this strategy, which is covering the necessary coverage. As to the indicator and the WHO 2030 goals, what we started to create from 2023, the construction of an indicator for those younger than 15 years. The percentage of coverage of HPV vaccination of the cohort born in 2012, we used in 2024, the 2012 cohort and seeing who were vaccinated in 2024, and we saw an increase of almost 10% of coverage. The idea is to follow this cohort, and after 2021 all cohorts. The impact in the introduction of HPV vaccine, we have to see the moment, especially the short-term impact, where we will see the prevalence of infection and circulating genotypes, and also precancerous lesions, and at the medium to long term, the incidence of precursor lesions, with the incidence and the mortality for cervical cancer. This is a joint study done in Argentina with the Malbrán Institute. We analyzed women of between 15 and 17 years of age who had not been vaccinated. 56% of the samples were positive and 42% had high risk. This allowed us to start a baseline of vaccination. As we can see, we see that 26, 52, and 51 were the more prevalent. This is another latest study that took the same population group, women of 15 to 17 years of age, and we compared cohorts that have received the vaccine with cohorts that had not received the vaccine. And this study showed an important impact. As you can see, in yellow we have the column of non-vaccinated women, and then in blue, the vaccinated women. And we can see how the incidence of VPH was reduced. This study was done with bivalent vaccine, and this also shows us the work here and the transmission. As I just said, the vaccine showed in this study an effectiveness of 93.4% and almost 90% in a different subcohort. As to a single dose, there are different studies that show that a single dose in women younger of 20 years of age. These are the main studies that we use. The evidence is the effectiveness and the immunogenicity, and the SAGE expert groups of WHO in December 2022 also talked about the single dose and it prioritized women of less than 14 years and to make sure that they received at least one dose, and the immunocompromised groups should have more than one dose, and it is proposed to extend the vaccine to greater populations, including males above 15 years also. The TAG in May 2023 endorsed what the WHO had said, and it also stressed the importance of strengthening the HPV program. And that's something very important is that the approach to the prevention of cancer has to be a comprehensive approach. Work group met, then they provided the guidelines to CONINE, and since 2024, the Health Ministry has determined that minors receive a single HPV vaccine dose. Within the benefits, obviously, one is the simplification of the vaccination program, improving the coverage, extend the benefits of vaccination. We need a better global supply, and we can extend the vaccine to other population groups. We need to improve the global supply, and we need to reduce vaccination costs and the orientation of resources. All of these were important benefits. Many countries in the world have already adopted this strategy. already 24 countries that have adopted the single dose. Canada, the United Kingdom, Australia, and most other high-income countries. And we want to extend the group. Before, we contemplated the vaccine only in people living with HPV and transplanted. Thanks to the single doses, we extended this to people living with lupus and other dermatological and intestinal diseases. Obviously, in this population, yes, we maintain a multiple dose scheme, and we have to stress that the ideal is for these people receive this vaccine before the immunosuppression. As the younger the person to whom the vaccine is applied, the better, the more effective the vaccine. The lower the age, better. Now, I talked about the single dose. Now, as to the non-valent vaccine, this vaccine shows that the effectiveness is none less than in the immunological response to other vaccines. In Argentina, the incorporation of the non-valent vaccine was very important because in Latin America, HPV 16 and 18 represent 70% of genotype that cause cervical cancer. And even though the single dose scheme was valid, once we incorporated the non-valent vaccine, the coverage was better. Final considerations, evidence-based national strategy covering many years. Now we have the single dose. We amplified the scheme, and we applied the non-valent vaccine as a challenge. Obviously, in Argentina and the world, we need to improve the vaccination coverage. We need to strengthen school-administered vaccination. Strategic partners, education ministries, for example, training for the health personnel. And another fundamental thing is to support and to maintain the comprehensive approach. Now, vaccination against Hep B virus. This is a disease that has a prevalence of 3.5%. In 2022%, hepatitis B killed approximately 1.1 million of people, principally for cirrhosis or hepatocarcinoma, primary liver cancer. We know that 6 to 10% of those infected by the virus in Argentina evolve to chronic forms. In Argentina, the seroprevalence in blood banks for HBsAg varied between 0.14 and 0.34%. Hence, Argentina is considered a low prevalence country, less than 2%. Since the introduction of vaccine against Hep A, the Hep B infection is the main factor in liver diseases. Now, universal vaccination started in 1992 with the health personnel. In 2000, we incorporated this vaccine for newborns. In 2003, we incorporated 11-year-old children. In 2009, we incorporated the quintuple combinated vaccine. Our strategy points to avoiding chronic Hep B and to reduce mortality for this vaccine preventable disease. The scheme is 3 doses between 0.1 and 6 months. It's a very effective vaccine, more than 95% in newborns, children, and young adults. And
que ya recibieron 3
this
dosis,
is,
es cierto,
it
algunas
is
no
a
recibieron el
reinforced
formulario como
dose
personal de salud
is not
y con los
recommended
individuos
for
con
people who
riesgo
have
al
received
hepatitis B.
the initial doses.
Las vacunas que contamos es la monovalente para
We
recién
have the
nacidos y
monovalent
dentro de la vacuna
Hep B
quíntuple
vaccine for
también,
newborns,
igual
and
que las
within
vacunas
the
contra VIH, que
quintuple
son
vaccine,
son
just
muy
as the
seguras.
HPV vaccine, this is a
Y
very
en nuestro
safe
país, más
vaccine. And
allá
in Argentina,
del
beyond
plan nacional, tenemos
the national plan,
siempre ponemos mucho hincapié en realizar
we
acciones
always
intensivas
stress
en poblaciones de ya sea más riesgo de enfermar
populations
o más
of
riesgo
at
hospitalizarse
higher risk
por este virus.
of becoming
Principalmente
ill
trabajadores de salud
or more
muy
risk of
priorizados porque son
complications
atendidos
for this
con
virus,
hepatopatías crónicas, privados
especially
de
chronic
libertad, incluyendo personas viviendo en cárceles,
disease
usuarios de drogas endovenosas, personas
patients,
viviendo con
health
VIH y
personnel,
convivientes y parejas de portadores de hepatitis B crónica.
prison inmates, and other
Con respecto a
high-risk
recién
groups.
nacidos, en
As
nuestro
to
país,
newborns,
todos los recién nacidos
in
dentro de las 24
Argentina,
horas de
all
haber recibido una
newborns
dosis de la
within the
vacuna
first
contra
2
HPV
hours
y a su vez
receive a
los recién
dose of
nacidos
Hep
de
B
madres
vaccine,
portadoras deben recibir la
and then
gama
those
en el periodo de
born
tiempo, lo
to
antes posible que
Hep
se pueda conseguir.
B
Con
carrying
respecto a las
mothers
coberturas,
receive an
esta
additional
vacuna
dose. As
nosotros
to
tenemos
the
cobertura con la
coverage,
dosis neonatal del
this is
2023,
the
la cobertura
neonatal dose. In
45%, es un
20%, we
valor que es
attained
más
a
bajo que
coverage
el
of
resto del calendario nacional. Esto
45%
se debe a que
of,
principalmente
sorry,
tuvimos bastante
55%
dificultades para la
lower
hospitalización en las
than
maternidades y en las
other
maternidades
coverages
privadas,
because
es
we
muy
have
complejo. Y otro
difficulties.
tema también es
And
que los
another
neonatos
issue
no cuentan
is
con
that
DNI, entonces se hace
newborns
un poco
don't
difícil
have
para
a
poder
national ID
identificarlos o realizar un
document,
trabajo
so it's
forense.
more complicated to
Así que como
determine and
conclusión,
to monitor
fundamental
those cases.
el
And
registro y
in
mantener
conclusion, it's
la
very
cifra actualizada
important
y poner
to
todos nuestros
register
esfuerzos
the
para tener
dose
un registro que
of
refleje la realidad de la
vaccinated.
población
To
y además
have
es necesario
a
capacitar
good
al equipo de salud,
register,
que es
we
una
need to
población adulta
raise
para captar
awareness and
esta
train the
población de
health
riesgo
team,
y
team
también
taking
realizar
care of
estrategias de
adult
comunicación
population, and
también
then we
para
need to
captar la mayor
implement
cantidad de esta población.
communication
Muchas
strategies
gracias.
and to
Quería hacer
promote
como
the
comentario
demand.
final.
And
Yo
finally,
pertenezco a la
I
Dirección de Control
belong
de Enfermedades Inmunoprevenibles. El 31 de
to
enero
the
hemos recibido
Secretariat of
el despido
Access
de
and Health
10
Equity.
compañeros de nuestra oficina. El 30% han sido despedidos. Esto
But
realmente nos preocupa
we,
muchísimo, ya que
30%
serán
of our
despedidos personas
colleagues
en lugares
have
clave,
been
personas que se
fired
encargan
because
de la
this is a
movilización
very,
de usuarios
something
para
that
la
concerns us a lot because
monitorización, las coordinadoras que
we
desarrollan
lost
justamente este tema
professionals with a
de
lot of
VIH y
institutional
hepatitis y
memory, and we
seguimos.
had
Quería
health
comentar esta información
personnel
que tenemos, que
with
esta
experience
dirección
in HPV
trata
and
de garantizar
hepatitis. So
a través de
this
los
massive
años
firing
garantizar
will have a
a toda la
problem.
población
But I thank you very
que
much. We
esperamos
want
que
to
siga siendo
extend the
así. Gracias.
vaccination to the entire population, and we
Muchas
hope to
gracias.
continue
Sí,
having
creo que
success.
ese
Thank you.
esfuerzo
Yeah, thank you very much. I
para
think
llegar
that
a
this
tener
effort
programas tan
to
exitosos como el de
have
ustedes ha tardado muchos años, hablando
programs
de
as
VIH,
successful as yours.
2016,
You spent
2014,
many
2015,
years,
17,
2014,
2024,
15,
llegando
16,
hasta la
17,
simplificación
2024,
de la
analyzing
primera
HPV
vacunación a
to
una sola
simplify
dosis.
the
Creo que es
vaccination scheme to
importante
attain a
para
single
los países
doses.
que
This
están
is important
tratando
for the
de
countries that are trying
reducir los
to
costos que
reduce
vienen
costs
asociados a esto, pero no solo
associated to all of
reducir,
this.
sino que
But it's not only a
cómo se
matter of
redistribuye
reducing
los fondos que
costs,
se
but
hacen
also
al tomar
to
esa
see
decisión. Creo
how
que es
the
un gran
funds
mensaje que
are
pueden llevar los
redistributed.
países
This
para
is a
ver
great
al
message
hacer
for
este
the
ahorro cómo
countries
se puede
when making
redistribuir
these savings,
los
how
recursos
these resources
en
may
esta
be
área,
redistributed in
la
this area,
relación y el buen trabajo que se tiene que hacer con los ministerios de
because
educación en el
we
caso de las
need
vacunas de
to do
VIH
a
y bueno,
good
y en el
work
caso
with the education
del
ministries in
carcinoma de
the case of
hepatocelular a
HPV
través de la
vaccine,
vacunación.
and
Lo
the
mismo podemos ver desde
hepatocellular
los años
carcinoma
90
through
hasta el
vaccine
presente,
also
siempre
is
la
an
necesidad de
important
estar
case.
trabajando alrededor
Since
del área
1990, we,
y creo que
and to
un
date, we are
denominador en
always
general
seeing the importance of working
en
in
gran
this
parte de este
area. And a
mensaje
common denominator
falta
is
que
that
vacunación tiene muy fuerte es el tema de la importancia de mantener un buen
in the area
registro
of
para la
screening, it's
toma
very
de
important to have a
decisiones en
good
políticas de
registry
salud.
to make
Nuevamente,
it
muchísimas
possible to
gracias
make good
por
decisions
la
and have good
presentación y
health
compartirnos el gran trabajo que se ha
policies.
realizado a
Thank you
través de los
again for
años
your
que nos
presentation
conlleva a
and
poner
for
a
your
Argentina como un
important
ejemplo
work
en la
over
región
the
en
years
este
that
tema.
makes of
Muchas gracias.
Argentina an example in the region in this
Bueno, y
area.
ahora
Thank you
vamos
very
a
much. And now
continuar
we will
con nuestra
continue
otra
with the next presentation about experience, now moving from prevention in the use of vaccines, immunization. Now we move to the access to medicines, and it is a pleasure for me to introduce Lisette Marmul, pediatric oncologist, the focal point of childhood cancer in the Ecuador Health Ministry. She will talk about the platform mentioned to access to medicines against childhood cancer and how has Ecuador's experience been as the pilot country in the region.
Good morning. It's always a pleasure to share the experience of my country. Thank you so much, Mauricio, for the introduction. Today, I have Dr. Lidia Camacho with me. She is the National Director of the Non-Communicable Diseases Unit at the Public Health Ministry. The items that we're going to review today will be presenting the context for this platform of access to childhood cancer medication, and then the process of implementation, what's happened between 2023 and 24, what we want to do in 2025, and future steps.
Y bueno, muchos de nuestros países
Many of our countries
están relacionados o tienen puntos en común.
There are common points because we are countries of low or medium income, which means, according to international literature and reports, that 90% of children and adolescents with cancer live in our countries. The reality is that only 1 out of 5 survive. So this generates concern,
que pueden sumar esfuerzos para ser más
and
fuertes y
efforts
cambiar esta
are
realidad.
needed to change this reality and become stronger. One of the problems is the scarcity of medicine. Many governments needed to procure cytostatics, and when it comes to the cost and the supply available, which means that these patients are exposed to receiving medicine of suboptimal quality, and if there is a shortage, it could even expose them to falsified or counterfeit medicines. It's a high cost because we're talking of the lives of children and adolescents, and as well public funds. Many countries do not have access to basic kits for cancer treatment, and this is a major expenditure for families and society.
Entonces, ¿cómo nace la plataforma mundial de acceso a
gave rise to the global platform for access to childhood medicine access? In 2021, St. Jude's and WHO announced the availability of this platform because one of the problems is access to quality medicine. Depending on the estimated budget, it's about $200 million. The intention is to provide effective and quality medicines, guaranteeing a first line of treatment and even a second line for these children. The impact will be on 120,000 children and adolescents in 6 years. This begins with a pilot phase. One country is selected per region, and Ecuador is the one selected in the Americas, with Jordan, Mongolia, Nepal, Uzbekistan, and Zambia. There is somebody's microphone open. If it can be closed, please.
En el codiseño que existe con estas instituciones expertas en cáncer, St. Jude,
thanks to this effort
el apoyo invaluable de la
and the
Organización
invaluable
Mundial de la Salud,
support of the World Health
se utiliza
Organization,
este esquema
this
los centros de excelencia,
center is
tanto para
used,
iniciar las
the
campañas
excellent
internacionales de acceso
centers
a
to
diagnósticos
the
tempranos,
cure-all
referencia
platform
inmediata,
and
el
immediate
entrenamiento
reference.
del
And the interpreter
personal,
regrets,
optimizar
but there is a
infraestructura y el
voice
equipamiento de las
overlapping
instituciones
Lisette
que
Marmol's
tratan a
voice. We
estos
can
chicos con
hardly hear
cáncer.
her.
La cobertura universal
Universal coverage
para tener
is what we
acceso
seek
al
in order
prediagnóstico,
to
al
have
tratamiento,
access to
soporte y cuidado
pre-diagnosis,
paliativos para sus
treatment and
familias
support and
necesarias para estos
palliative care
pacientes
that's so
e intentar
necessary for these
crear
patients, and
o
try to
agrupar en paquetes
create
de
or
salud
group together in
para
health
garantizar el
packages
acceso
in
a
order
las
to
familias
guarantee
que
access
sobre
for
todo van a tener una
families
limitación
who
económica.
will have economic
Unificar
constraints.
eh, o socializar
Unify
a nivel
or
nacional unos
socialize
perfiles de tratamiento
nationally the
con guías y
treatment
protocolos
regimes
nacionales,
with
la
national
evaluación y
guides and
monitoreo, porque
protocols,
toda estrategia tiene que ser
evaluation and
evaluada por
monitoring,
un
because
tiempo
any
para ver cuál
strategy
será el
needs to
impacto
be
que tenga.
monitored over time
Y
to
uno de
assess
los
its
objetivos de la
impact.
plataforma
One
de
of the
acceso a medicamentos
objectives
frente al
of the
delincuente es
platform for
aumentar la
access to these
supervivencia de
medicines
los chicos
is to increase
hasta
children's
el
survival
60% al
by
menos.
60%
Nosotros
or to
sabemos que países de
60% at
bajos y
least.
medianos ingresos en
Low
sus
and medium
estimations sigue
income
entre el 20 y el
countries have a
40%.
survival between 20 and
Y es tan
40%
dispara
only. And
precisamente
it is so
porque hemos
disparate
estado
precisely
trabajando
because
un
we
poco
have been
separados.
working
Nada de
separately.
estos cuatro, ninguno de estos cuatro
None of
pilares
these
pueden
four
sostenerse
pillars
si no
can be
tenemos el amparo
sustained
o el
if we
apoyo
don't
de la
have the
parte gubernamental.
support from
Entonces tenemos que
governments.
definir
So
roles,
we
el tema de
needed
la
to
abogacía,
define roles, and
los
that's
roles
where
de, de
advocacy
los
comes in,
participantes y los
the
diferentes
role of
involucrados, el
participants and the
financiamiento que puede ser gubernamental o
financing that
externo,
can be
la parte
governmental
de
or
gobernanza,
external,
donde se establecerían las
governance
políticas
that
de salud y los
provides
planes
the health
nacionales,
policies and national
¿no?
plans.
Entonces, lo que aspiramos ahora
So
como
what
país
we
es
hope
poder
as a
ser parte de una
country
historia de
now
éxito
is
en
to become
esta
part
acción
of a
nacional que esté
successful story
involucrada
in
en
this
diferentes
national
sectores.
action involving different
Siguiente
sectors.
diapositiva. ¿Y cuál ha sido el camino adecuado?
And which
Bueno,
has been
primero
the
tenemos
right
que saber
path?
cuál ha
Well,
sido la
first we need to
parte, cuál es la realidad
understand
de mi
the
país, ¿no?
reality in my country.
Fuimos seleccionados en el
We were
2023,
selected in
tuvimos que realizar un
2023.
diagnóstico
We needed to
situacional de
have a
cómo es el
situational
cáncer en mi
diagnosis of
país con
cancer in the
apoyo del IPS.
country. This was
Se
done with
identificaron
PAHO
pilares de
support,
trabajo, lo que
identifying work
finalmente nos está
pillars.
acercando
And
ahora en el
finally, this is now
2025
bringing us in
a tener
2025
estos
to
medicamentos que van a
having
venir
these medicines that will
ya
be
ahora la próxima
provided
semana.
and that we'll hope to receive
Siguiente
next week.
diapositiva.
Next slide.
Siguiente. Entonces, priorizando la equidad, protegiendo a nuestros niños, niñas y
Prioritizing
adolescentes
equity,
afectados por cáncer,
protecting our
vamos por
children
cáncer,
suffering from
vamos a
cancer.
procurar promover
And
en
through
todas
this, we
nuestras
hope to
acciones
ensure that all of our
le den el
actions
valor adecuado a
provide
la
the
salud
right
de esta
value
población. Siguiente.
for the health of this population. The interpreter again regrets, but there are
Y esta es la
voices
situación del cáncer infantil en mi
continuously
país.
affecting the
Entonces,
audio quality. This
esta
is the
información
situation of
corresponde al
childhood
perfil
cancer in my
epidemiológico que había
country. This is
compartido
the
OMS en el 2021.
epidemiological
Hay datos un
profile
poco más
from
actuales. Para el
2021. We do have
2022
more
según Global
updated
Cancer, son
information, but
1.074
according to
casos nuevos
2022, there are
de cáncer en menores de 19 años que se diagnostican en el
1,027
país.
additional cases of childhood cancer in
De
my
estos,
country.
del 50 al 59%
50 to
sobreviven
59% of these
si
survive
tienen leucemia linfoblástica.
if they have lymphoblastic leukemia.
Apenas nuestro cuadro nacional de medicamentos
Our
básicos
national basic
incluía un
medicine framework
82% de
included
los citostáticos que se requieren para
82% of the
primera o segunda línea de
cytostatics
tratamiento.
required for the first and second
Tenemos 7
treatment line. We
centros
have
donde
7
se trata cáncer
centers
infanto-adolescente
where childhood
entre
cancer
la red
is
pública y la
treated
privada. Y
between government and
no
private.
teníamos en este momento
And
un
what we
programa
don't have
para
or
la
didn't have
detección
is
precoz,
a program for
aunque
early
sí tenemos un
detection,
sistema de
although we do
referencia
have
definido que se
a
convierte en
defined
una
referral system
oportunidad para
that
nosotros.
becomes an opportunity for
Y
us.
estos números,
And
poder
these
visualizar
figures,
esto,
to be able to
nos permite
visualize
situar
this,
o identificar el
allows us
problema
to
para saber qué
identify the
acciones
problem,
podríamos
to
tomar.
understand what
Siguiente
actions are
diapositiva.
needed.
Empezamos a revisar cuáles podían ser
We
nuestras
began
fortalezas.
to
Pues
look
tenemos
at
un
our
sistema de salud
strengths. We
conformado por
have
una
a health
red
system
pública y
that has a
complementada y
public
también una red
complementary
privada,
network and
¿no?
also a
Entonces
private
nosotros los
network.
tenemos
So
identificados como MSP,
these
los
have
seguros
been
sociales,
identified
también
as
son de las Fuerzas
MSMP,
Armadas, de la
which
Seguridad
is
Social y de los hospitales de la
insurance,
Sociedad de la Lucha
and
contra el
then there
Cáncer,
are
¿no?
hospitals.
Tenemos una estrategia
We
nacional de
have a
cáncer contra el
national
hipotempo en
cancer
niños, niñas y
strategy
adolescentes
that, although it
nos
doesn't
forma un
focus on
paraguas
children's and
para poder
adolescents,
tomar
does provide
acciones
an
dentro de
umbrella for
esta
actions to
normativa
be
y un cuadro
adopted
nacional de
under this
medicamentos
initiative. We
que con
have a
una
national
actualización, una
medicine
reforma a la
table,
norma que había ocurrido en el
and with a
2022 nos
reform that took
permitía
place in
ingresar o
2022,
autorizar
allowed us to
medicamentos
authorize
en un
medication
tiempo menor, ¿no?
in less time.
Y
allowing them to enter the system, and a network of palliative work that began working several years back and over time has become stronger. Under opportunities, we receive support from PAHO, from the Strategic Fund. There is a regional initiative through ORASCOM for early cancer detection in children. And we also needed to identify our weaknesses. Hospital records don't interoperate. There is not much training for the specialists required in oncology and palliative care. Amongst our threats, unfortunately, a lack of monitoring and follow-up of patients, precisely due to the lack of interoperability of the records in pediatric hospitals. And each sector was working
desde su campo,
in its own
dirían
field.
coloquialmente desde su trinchera, ¿no? Entonces, si no
So
involucras a la población,
if you don't involve the population, if you don't involve the social workers, then how can you truly have an impact in a country that is so diverse, where we have language barriers, geographic inaccessibility, and I think several countries in the region share this characteristic.
tenemos un marco legal que nos
We have a
permite
legal framework that does allow us, as Ministry of Public Health, to operate and make decisions as the directing entity for the health sector. We have the Constitution of the Republic, the Organic Law of Health that allows us to design and implement programs, the 10-year plan 2022 that we hope will extend to 2031, and the objective is to decrease non-communicable disease cases by 25%, and the national strategy of integral cancer care that contemplates as well children and adolescents. This is going to be updated this year, and that will allow us to reach out to a greater population. Next slide.
Siguiente. Entonces, por repasarles lo que ha sido
To
todo este
summarize
proceso de implementación,
the implementation process that will finally give us 35 medicines that are considered essential for cancer treatment, with about 59 formulations. Ecuador was selected as representative for the Americas in February 2023. In April that year, we participated in the launch that took place in Memphis. By July 2023, we were able to involve civil society, academia, other sectors, foundations, in order to raise awareness about the project and point out that we needed to work together. With WHO support, a mapping of professionals in the country was performed, and understand which would be our areas of opportunity. We don't have a national cancer institute, so we began with focal points. But with government changes and the high change in officials, which is a characteristic of so many of our countries, we have tried that regardless of who was in the office, that we continue operating. Between August and December 2023, 13 potential hospitals were selected to benefit from the medicines that will be donated by the global platform GPA-CCM. And we also had to begin with center evaluations in order to identify their shortcomings. We need to be governed by this cure-all strategy. And we're talking of centers of excellence. We need then to understand which centers are available, how they can be strengthened, and how we can put them to better use. So that was one of the tools that we availed ourselves of.
Y nuestro equipo gestor está formado
And our
por
management team
representantes del Viceministerio
comprises
de Gobernanza y
representatives from the
representantes
Vice
del
Ministry of
Viceministerio de
Governance
Integración
and
Integral de Salud,
representative
con las
of the
direcciones
Vice
que están
Ministry of Health,
directamente
Integral
sobre la
Health
Dirección
Care,
Nacional de Enfermedades No
and different
Transmisibles, donde
departments such
estoy,
as the
pertenezco en este
non-communicable
momento,
unit, which
la
I belong
Dirección
to
Nacional
right
de
now,
Regulación de
the National
Medicamentos,
Regulation
la
for
Dirección
Medicines, the
Nacional de
National
Atención
Direction
Integral de la
for
Salud, que es
Integral
prácticamente
Medical
primer nivel,
Care,
quien está
which is
manejando los
primary
programas
level,
de
and they're
detección
in
precoz,
charge of early
y la Dirección
detection,
Nacional de
and the
Abastecimiento
National
de
Direction
Medicamentos
for the
y
supply
Dispositivos Médicos.
of medical
Y tuvimos que fijar
devices
los
and medicine.
puntos,
And we
objetivos y
needed
metas
to
a corto,
set
mediano y largo plazo.
medium,
Siguiente
short, and
diapositiva.
long-term targets. Again, the interpreter regrets, but there is
Estos son
some
nuestros 4
microphone
pilares de
open, so
trabajo.
the audio
En
we're
la foto
receiving
pueden
is
ver a
not
nuestra
very good.
consultora nacional,
This is
que
a
es la
pillar.
doctora Villacrés. En la foto de abajo es el primer
You can
taller que
see
logramos
the
hacer
first workshop
para
in this
socializar y
lower
invitar a todos los
photograph. We were able
sectores
to
a
invite all
participar
the sectors to
en el trabajo
join
que
us and to
teníamos que hacer para
participate
poder
and explain to
implementar
them
este
the work
proyecto,
needed
¿no?
in order to
Entonces, nuestros
implement this
pilares de trabajo
project.
son la parte de
Our pillar
gobernanza,
works, governance,
la cadena de gestión de suministro, la
supply
gestión
management,
clínica
chain,
y
logistic
la parte de
management,
logística que incluye
and the clinical
cómo enviar los
management.
medicamentos, la
In
parte
logistics, we're
regulatoria, cómo se los
talking
va a
about
distribuir y demás.
medicine, the
Siguiente diapositiva.
distribution, etc.
Dentro de las acciones principales de estos
Within the main
pilares de
actions,
trabajo,
within these work
aparte del
pillars,
grupo gestor, vimos la necesidad
we
de
have,
crear
in
una Comisión
addition to
Nacional de
the
Cáncer
managerial team, we
multisectorial
saw the
que
need
se
to
pudo crear
create
en
a
junio de
national
2023
multisectoral
y
cancer
logramos
directorate
identificar también
created in
puntos
June
focales en las
2023.
5
And we
instituciones
also
primero de salud
identified
pública y
five
luego
focal points
en
in
las
5
otras
public
4
health
inicialmente
institutions, and then
restantes de la red
in the
complementaria,
remaining
pero permanecían
4
resueltas.
institutions of the
Gracias a estas
network.
conformaciones se logró
And
del equipo gestor inicialmente
this
firmar la carta de
allowed us
intención
to
inicialmente para
sign the
participar de la
letter of
plataforma y
intention to
luego las cartas fuertes.
participate
En la
in the
gestión
platform,
clínica
and then the
levantamos
letter of
los protocolos
commitment.
que se estaban utilizando a
We
nivel nacional. Vimos
implemented
que había demasiada
we
diversidad, que
determined
era
the
necesario entrar a un
protocols
consenso
being
y
used at a
eventualmente empezar
national
con lo
level.
clínico,
They were
entrenamiento
too
de recursos
numerous,
humanos
so
y
we
muchas veces olvidamos que
streamlined
no
this.
solamente los médicos
Oftentimes we
tratamos
forget
cáncer,
that not only
hablamos de
doctors
químicos
treat
farmacéuticos, de
cancers,
enfermeras,
there are also
de
nurses,
el personal de
pharmaceutical
limpieza,
professionals,
de las personas que hacen la
cleaning
recepción de
staff,
los medicamentos y los
and
traslados, ¿no?
those who
Empezamos
receive and
a
transport
incorporar
medicine.
puntos
So we
focales de
started
otras
including
direcciones
focal points
involucradas para que
from
puedan
other
darnos sus
involved
aportes
directors
dependiendo del
so
rol de
that they
expertos que
could give
estuvieran y fuimos
their
identificando cuáles
contribution
iban a ser
depending
nuestros
their
nudos
expert role.
críticos en la
And then
cuando los
we
medicamentos
determined the
llegasen
critical
y
factors,
tuviéramos que agilizar
and we saw
los
the need
procesos
to
regulatorios
streamline
para
the
la
regulatory
importación,
processes for the
el control
importation of
unitario y la
medicines,
distribución de
the
estos
inventory
medicamentos, ¿no?
control,
Y
and the
saber qué va a pasar
distribution of these
con esta
medicines, and know
medicación,
what will
si vamos
happen
a
with
llegar a
these
ese
medicines,
objetivo,
if
garantizar
to
que podemos
see
llegar a
if
este objetivo del
we can
60%
make
de
sure that
supervivencia
we can
en el
arrive
último
to
año.
the objective
Siguiente
of
diapositiva.
60% survival rate in the next 5 years.
En el 2024
In 2024,
logramos solventar. Lograr es una palabra muy repetida en esta presentación, pero todo ha sido un logro porque
we
si
were
ustedes
able,
recuerdan bien, una de las primeras diapositivas era
we had the
el
achievement, and
cáncer
I
en
use
el Ecuador es un
deliberately
gran
the
desafío.
word
El cáncer en los
achievement,
adolescentes es un gran desafío. Entonces, los
because we had
criterios mínimos
achievements
actualmente para
facing
que
the
un centro
challenge
pueda tratar
of
cáncer
childhood
en
cancer. The
general hemos alcanzado el
the
96%.
minimum
Hemos logrado
criteria
agilizar las
were
áreas de
completed for
preparación de
first phase
medicamentos. Se
hospitals.
firmaron las cartas de acuerdo,
We
como les
signed
decía, en
letters
abril
of
del
agreement
2024.
in April of 2024.
Entre julio y septiembre se logró realizar una
Between July and September
reevaluación
of last year,
y una
we
nueva visita
reassessed the
a los centros
criteria and
para
we
ver cómo
visited
estaba el
again the
personal
centers
y
to
cómo
see
iban
how the
los
staff was
procedimientos
going
operativos
and
estandarizados
how
bajo las
the
normas hospitalarias de
operational
cómo se iban a manejar
processes
estos
were being
medicamentos. Se
incorporated
empezó
to
a trabajar
manage
en
the
variables
medicines.
clínicas y
We
variables de
started
gestión de
working
suministro para
on
monitorear
clinical
qué es lo
and
que va a pasar con
supply
la donación
variables to monitor what will
de
happen with
citostáticos.
donated
Y de octubre a
medicines and others.
diciembre fuimos
And
uno de
between
los
October
primeros
and
logros
December of
que de manera colaborativa
2024,
con la OMS,
we
con
attained
OPS y con
one
la
of our
OMS
main
se
achievements,
sacaron
one of our
contenidos
first
básicos para preparación de
challenge
quimioterapia para
achievement
niños, niñas y adolescentes con
with
cáncer. Esas son las
the
informativas
definition of
publicadas en el
basic
núcleo
criteria for
embajador de Trabajo Social de
chemotherapy
Salud
for
Pública
children
y
with
comenzamos a
cancer.
prepararnos
And we
ahora para la
started to
recepción del
prepare
equipamiento
now
para
to
garantizar la
receive
cadena de frío de los
hardware to
medicamentos.
guarantee the cold
Siguiente
chain
diapositiva.
for these medicines.
¿Y qué es lo que hemos alcanzado después de este trabajo
What
que no ha sido
have we
nada
attained
sencillo?
after
Primero
this
porque
work, which
creo
has
que
been
todos compartimos la
very
idea,
complex? First of all,
más que
because
la
we
idea,
all
compartimos el sentimiento de que
share
todas las
not
barreras
only
que
the
tenemos
idea,
en
but the
cáncer
feeling that
infanto-adolescente es porque el cáncer
all the
infanto-adolescente
barriers we
no es
have
accesible. Representa menos del 5% de la carga total de
for
cáncer de un país.
childhood and adolescent cancer
Pero
is
sin
because
sabemos
it's
que
a
hay como
that
especialistas pediátricos que
disease is not
difiere
visible, and we
grandemente de
know
la
that
población
this
adulta, ¿no?
differs
Entonces,
a lot
poder
from
concientizar
cancer
a
in
nuestras
adults. So
autoridades
we
para
need
avanzar en
to
este
raise
fortalecimiento
awareness
ha requerido
to our
establecer un mecanismo de
authorities in
gobernanza
this
desde el equipo
respect. And
gestor,
this
la Comisión
required the
Nacional de
establishment
Cáncer
of a
y poder
governance
trabajar
mechanism with the
articuladamente con las
management
diferentes
team,
instituciones, tener las
the
cartas todas
National Cancer
firmadas, los
Committee, and we
procedimientos
signed
operativos
letters of agreement for
estandarizados que ya fueron
standardized
aprobados por las
operational
instituciones donde
processes
van a recibir a estos chicos con
that
cáncer.
were approved
Hemos
by
mantenido
the
un trabajo
institutions that will
colaborativo
receive
muy cercano, hombro a hombro
kids
con
with children
OMS y
with
con St. Jude,
cancers. We
alcanzando
worked
hasta el 96% de los
together with
criterios mínimos
WHO and St.
para no
Jude's,
solo la recepción de
attaining
medicinas, sino también para
97%
tratar a los
of the
chicos, ¿no?
minimum
Un plan de
criteria to
implementación que fue
treat
desarrollado
children.
y validado
And
de manera
we
conjunta por todas las instituciones
implemented
involucradas.
actions
Usamos una
validated by
nueva
all the
herramienta de estimación de
institutions
necesidades
involved.
de
We
drogas
have
que ya no se
9
basa
tools
en el
for the
consumo promedio mensual, sino en el método de morbilidad para
participation
disminuir
of
esta
civil
inaccesibilidad que
society.
teníamos porque usábamos consumos
95%,
históricos, ¿no? Y
96%
finalmente una
of
propuesta de
progress in
asignación de
assessment
fondos
of
de apoyo
criteria.
al
And then
país
there's
para
a
fortalecer
proposal to
nuestras
assign
debilidades
funds to
aprobada, ¿no?
strengthen our weak
Siguiente
points.
diapositiva.
This was approved.
Para el 2025 lo que esperamos al final,
For
porque en aras del tiempo voy a
2025,
acelerar un
what
poco,
we expect, on
tenemos
behalf of time, I'll go more
como
quickly.
objetivos en este primer
Our
trimestre,
first objective in the first
de hecho,
quarter of
va
this
a
year,
la semana del 17 al 20 de febrero,
in
poder
fact,
lanzar los lineamientos
this
de
week
detección
from
precoz para difusión a primero,
17
segundo
to
nivel,
20
articulados
February,
con los hospitales a donde
the
deberían
periodical
referirse estos
follow-up
chicos para tratamiento,
for early
diagnóstico y tratamiento,
diagnosis,
o a la red complementaria.
and also to involve the
Empezar
complementary
con
network. And we
más que
also,
empezar, ya hay un borrador
we
de un
already
plan
have a
nacional, una propuesta de
draft
plan nacional de cáncer para niños, niñas y
of a
adolescentes, que es un
national
objetivo que
plan
tenemos para este año,
for
cuatrimestre, perdón, en el primer
adolescent
cuatrimestre.
children
En
and
el segundo
adolescent
cuatrimestre
cancer.
vendría la primera evaluación a
In
los
the second
hospitales de la
quarter,
segunda fase,
there would be the first
de los
assessment
hospitales
of
de la red
second phase
complementaria.
hospitals in the
Uno de los
complementary
objetivos
network.
grandes que tenemos
And one
también
of
es
our main objectives here
poder
is
finalizar
also
las
to be
adecuaciones de la
able
bodega
to
central. En este momento tenemos un plan de contingencia que es
finalize
sólido y está
the
debidamente socializado y
adaptation
aprobado,
of the
y
central
empezar con la estimación de las necesidades
deposit,
para los medicamentos
and
para
we need to
2027.
estimate needs of
En el último
for
cuatrimestre iríamos con la
2027.
revansa
In
sobre los
the
criterios
last
mínimos de las instalaciones hospitalarias que han sido seleccionadas
quarter,
para
we
participar
will
del proyecto y
reevaluate
evaluar los
the
primeros datos del
minimum
registro
criteria,
hospitalario con
and we
variables de
will
necesidad.
assess the
Para el
first data
2026
of the
podemos
hospital
tener
register.
los primeros
And for
resultados y cómo nos ha ido
2026, we could have
en
the
este
first results
2025,
of how we
una
have
vez
done in
recibidos los medicamentos.
2025 once we
Siguiente
receive the
diapositiva.
medicines. Next.
Siguiente.
Next.
Y uno de nuestros objetivos, y una de las preocupaciones que surgen es, bueno,
One
ahora
of our
tenemos a
main
St. Jude, ahora
concerns is,
tenemos
well, now
al
we
Fondo
have
Estratégico,
St.
tenemos a
Jude, we
OMS,
have the
que nos
strategic
están
plan, we
ayudando,
have
nos
the
están colaborando, están
WHO.
trabajando con
They are
nosotros,
helping
hombro a hombro.
us,
Pero
working
nuestro gran desafío
together
real
with us,
es
but
llegar a
our
institucionalizar este
great
proyecto
actual
para que el cáncer
challenge is
infanto-adolescente sea siempre visible
institutionalizing
y
this
poder cambiar
project
la
to
realidad de
give
ese criterio
visibility
criminológico de
to the
ultra-las cantidades
childhood
positivas.
and
Entonces,
adolescent
hacia allá
cancer.
estamos
So
caminando.
that's where
Por
we
eso
are
hemos
moving.
contemplado que este año debemos trabajar en un plan
So this
nacional de
year we
cáncer que
need to
sea una
work
realidad,
on
que
a
no solo un
national
borrador,
cancer plan
que
that
existan
would
flujos
be a
adecuados y
reality, not
organizados
only
entre
a
dicha
draft, and
oncología,
that
las
would be
instituciones
an
participantes,
adequate
garantizar
flow
la
of
entrega
participating
ininterrumpida de medicamentos
institutions
especialistas
to
como
ensure
esenciales como
the
OMS
continuing,
y
the
garantizar la
constant,
recepción de medicamentos y
uninterrupted
distribución de estos
delivery
a
of
los hospitales.
medicines and the
Siguiente diapositiva.
distribution of these medicines to the hospitals.
hemos aprendido que la única
We have
manera
learned
de
that
impulsar
the
un cambio,
only
¿no?
way to
en
implement a
sistemas de salud
change
tan complejos como los de
in such
nosotros,
a
en
complex
nuestros países o en
health
nuestra región,
system such as
es
ours
trabajar todos en
is
conjunto.
to work
Esa
together.
frase de juntos somos más fuertes
This
tiene que ser como una letanía, tiene que volverse
motto of
nuestro lema
together we
como
are stronger,
estrategia, ¿no?
this has to
La única
be
manera
more
de
than a
poder
motto, a
gestionar un
strategy.
cambio
The only
es
way
no
to
trabajar
manage a
separados
change is
y
not
mirar
to
un
work
objetivo
in
común.
silos
Al
and to work
final
towards
es
a
que
common
un niño,
objective
una
that
niña o
ultimately
adolescente con cáncer
a boy,
se
girl,
cure
or a boy, girl,
y
or
esté vivo
adolescent with cancer
después de 5
should
años.
be alive, should
Los
get cured
desafíos
from
en el
cancer
cuidado de
and
niñas,
be
niños y
alive
adolescentes con
after
cáncer pueden
5 years.
convertirse en
The
oportunidades para
change,
proteger
the
los cánceres. ¿Por
challenges
qué?
in the
Porque
care of
gracias a esto
children
podemos
and
optimizar el
adolescents
uso
with
más
cancer
preciso
can
de la
become
información. Dentro
opportunities
de
to
las entidades,
strengthen
los
health
sistemas de referencia
systems.
y organización de los
We
servicios
have
ya
because we
tenían
have
funciones. Tenemos
information
que
systems
optimizarlos
and
para
we
el
have
avance
reference systems
infanto-adolescente.
and service
Nos hemos dado cuenta de
organizations
la
that we
importancia
already
de
have. We
entrenar
have
al personal de
realized
salud,
that
no
it's
solo a los
important
médicos,
to
sino a todos
train
los relacionados.
not only
Y la
doctors,
importancia de
but
tener una
all
política nacional y
health
guías de práctica
staff,
clínica
and the
específicas
importance
para
of
esta
having
población.
national
Eso era
policies and
algo
specific
invisible
guidance for
en mi
cancer.
país en
This
este
was
momento.
something that was not
Ya
possible
no lo
years
está.
ago in
Ahora se escucha cáncer
in our
infantil
country. Now
y uno
we
piensa,
have
ya vienen los
progress. Now
medicamentos y
we
vamos a
hear
poder tratar
the
mejor a
word
nuestros niños. Siguiente diapositiva.
childhood cancer, and we already know that we have medicines
Y
to train
espero
to treat better this
poder
disease.
compartir
I
esta
hope
experiencia.
that by
Nuestros
having
países son muy
shared our
diferentes.
experience, well, our
Cada uno tiene
countries in the region are
fortalezas y
very different.
debilidades,
Each
pero
one
al
of our countries
final
have strengths
compartimos
and
ese
weaknesses, but
deseo de cambiar
ultimately
la
we
realidad
all
actual
share
de la
the
población
wish to
oncológica.
change the
Entonces,
current reality
gracias a OMS, gracias a
of
salud,
cancer
gracias a
patients. So
ustedes por
thanks
estar aquí
WHO,
presentes.
thanks St. Jude, and
Y
thanks to all of you
sin
for
más,
being
termino
here
mi
with us
presentación. Hay un
today.
video
And
y no sé si vamos a poderlo pasar.
I have a video
Eh,
at the end of this, my
Creo que
presentation.
podemos.
Can we show a video?
Esta plataforma global de medicamentos para tener
This
mejor acceso para
global
los pacientes con
platform
cáncer
of
es muy
medicines
importante
to have
para nuestra
better
estrategia de
access by
cooperación
cancer
en el
patients
país,
is very
porque
important for our
precisamente se
cooperation
enfoca
strategy in our
a
country because it
disminuir estas
focuses
brechas que
in
existen en el
reducing
tratamiento
the
y en el
gaps that
diagnóstico de
exist
los
in the
pacientes con
treatment
cáncer.
and diagnosis of cancer patients. We see with excitement and appreciation the associated entities such as WHO and health ministries because we all have an impact in the comprehensive management of pediatric oncology. For me, the platform means hope. I'm very happy to know that we will have uninterrupted access to medicines during 5 years for all of these oncological
It's not the only thing that we need
patients.
to do, but it is a necessary step that we must take as a global community if we want to improve outcomes for children with cancer.
Con la adquisición y donación de 35
With the
medicamentos
procurement and donation of 35 official medicines, health ministries will be in a better situation to change the life of children with cancer. This will improve the survival rate of children and hence the equity of access. So it's important that Ecuador participate because it frames our technical cooperation, adapting it to our country's needs.
Muchísimas gracias, doctora. En realidad,
Thank you very
lo
much,
que se ha
doctor.
presentado en tema en general no es nada sencillo, como se
This is a
mencionó.
very
El
complex
tema
area.
de
You
gobernanza,
referred
de
to
definir roles, cómo
governance,
actualizar leyes
governance,
normativas,
how
procesos
to define
regulatorios,
roles, how to update
ha
laws,
sido complejo, pero es una
regulations, and
excelente ejemplo de que sí
regulatory
se puede
processes.
hacer.
It has been a
Muy
complex
feliz
process.
de
but
compartir
it can
contigo la noticia
achieve
de que la próxima
good
semana se
outcomes.
espera
And
tener los
we
primeros
were
medicamentos
happy to
y
see
hacer el
that
llamado
next week you
para
hope
los
to
nuevos
have the
países
first
que van a ser
medicines
parte
and
de esta
make a
iniciativa
call
de pensar
to
en
the
el
new
tema que se
countries
resaltó
joining
de
the
la
initiative,
importancia de
inviting them
sostenibilidad,
to think
porque
about the
esto es algo que
importance
se
of
tiene que pensar
sustainability,
desde el
because
inicio.
we
Hay
need
un
to
apoyo de
start
todos
thinking
estos,
on
nosotros como
this
organizaciones hacia el país,
from
pero
the
el país
outset,
tiene que tener una
because
clara
we need
visión
to
de
support
cómo esto
the
va a ser
country
sostenible
as an
posteriormente. Pero
organization,
nuevamente
but the
muchas
country
gracias por
has to
compartir con
have a
nosotros
vision
todo
of
lo
the future
lo que han vivido y que
sustainability.
puedan
Thank you
servir de
very much
ejemplo para
again for
los nuevos
sharing
países
with
que
us your
se van a
experience, and
unir a esta
hopefully
iniciativa.
you will
Muchas
be an
gracias, doctora.
example and a
Y
model
bueno,
for
para
the countries
concluir
that
el
will
webinar
join
del
the
día de
initiative.
hoy,
To
nos va a
conclude
dar unas
today's
palabras la
webinar,
jefa de unidad de nuestra
our
unidad de
unit
enfermedades no
chief
transmisibles,
of
Silvana Luciani,
non-communicable
va a dar
diseases,
unas palabras
Silvana
pasivas
Luciani, will
del
pronounce
evento y
some
el día de hoy que
closing
vamos a seguir
words
durante el día
about this
tratando de
event,
asimilar
and we
mensajes
will
claves para
contribute to
la prevención y
disseminate key
control del cáncer.
messages for the
Muchas
prevention and
gracias,
control of cancer.
Mauricio, y
Thank you
felicitaciones
very
a
much,
todos los
Mauricio, and
ponentes hoy día,
congratulations to
Santiago,
all
Nora,
speakers
Lisette,
today, Santiago, Nora,
Carolina,
Lisette, Carolina, for
avances en los
having shown us
países
the
de América
advances made
Latina y
in
del
Latin
Caribe
American
también
and
en el
Caribbean
tema del cáncer
countries
y para
when it comes
mostrar
to
lo que está
cancer,
disponible
and
a
to show
través del
what
PAHO
is available
estratégico y
through
fondo
the
rotatorio
strategic
de
and
la
the
OPS.
revolving fund
Voy a
of
hacer algunas
PAHO.
palabras de clausura
I
en
have some
inglés.
closing words. I
I
will
just
say them
want
in
to, again,
English.
thank everybody for your participation, for your dedication and commitment to join us today in commemorating World Cancer Day. You know, there's a lot of hope on this day because it's the day that allows us in the public health community, in the cancer control community, to reflect on the cancer situation and the needs that we see day to day in our countries, in our hospitals, in our clinics. And we know that the needs are great. Every day there's more and more people being diagnosed with cancer across all age groups. And we know that there are great inequities in access to cancer care and to cancer medicines and diagnostics, which is why we from PAHO are committed to help expand access to medicines and technologies through the revolving funds like you heard today, but also to help strengthen the health system response to cancer, like we heard from the experience in Ecuador, to establish national cancer committees, to create national cancer plans, to ensure that the essential medicines list in the country includes the essential cancer medicines, that providers are trained and providers have access to all that they need, updated protocols, the latest technology, the accompaniment, the quality of care that's needed to help improve diagnosis and treatment and outcomes for people with cancer. And we call on you today on World Cancer Day. We know that many of you who are connected today may not be the ones making decisions on what medicines we procure, when and where they're distributed, but we call on you as a global cancer community to reach out to the decision makers, to the ones in governments who are making decisions on access to cancer medicines, to help increase utilization of the PAHO revolving funds. We saw from Santiago's presentation that we have more than 30 cancer medicines, all high quality medicines with 80 to 90% reductions in prices. So with being able to procure more medicines at lower prices, we can make sure that more people have access to cancer treatment, to life-saving cancer treatment. So we encourage everybody to please use this underutilized, extraordinary resource that we have, not only for cancer medicines, but also for HPV testing and ablative treatment devices, because we know cervical cancer is highly preventable through screening and treatment. And again, we offer HPV tests and ablative treatment devices at one unique low price, and we're aiming to expand access to screening and treatment. And just to conclude, please join us on a regional level for two major initiatives First, on cervical cancer elimination, and we heard about the advances in Argentina to increase coverage of HPV vaccination, as well as coupling with screening and treatment to improve coverage for screening and treatment. But we're aiming for all countries in Latin America and the Caribbean to join us to reach the targets of 90% HPV vaccination coverage, 70% screening coverage, and 90% treatment coverage to eliminate cervical cancer. So please join PAHO, join our efforts to eliminate cervical cancer in your country. And then secondly, on our initiative for childhood cancer to improve survival rates for children with cancer, that we know there's a great disparity in outcomes for children with cancer across the region, depending on where you're living and whether you're in a big city or whether you're in a rural area. So please join our efforts to increase access to childhood cancer care and to join us in increasing access to childhood cancer medicines. To help reduce some of those inequities and improve survival rates in childhood cancer. So thank you again for joining us in commemorating World Cancer Day. Please visit the PAHO website where we have a lot of information, a lot of tools, a lot of resources to help you in your work, in your day-to-day, to improve access to cancer care and treatment and improve survival rates for people with cancer. So thank you again, and let's commemorate World Cancer Day together. Over to you.
Thank you. Thank you, Silvana. Have a wonderful day, everyone. Solo vamos a quedarnos para unas fotos y invitamos
Let
a
us
todos los
just
que
take
pueden
some
abrir su cámara,
photographs
por
first.
favor.
Everybody who can, please switch on your video
Agradeciéramos
so
al
we
equipo
can
que ha
take
estado
some
apoyando hacer
screenshots
esto
of
una
all the
realidad y a los ponentes
participants
que se encuentran con nosotros
today. We
todavía.
want this to be a reality, and we also want to take a screenshot with today's speakers.
Creo que Carolina se fue.
Yes, que tengan un buen día. Chao.
Thank you all
Chao.
very much, and goodbye.